Welcome back, everyone. Back to school time, which means the kiddos will be sporting their backpacks. So this morning, we want to make sure your child is wearing the right size and wearing it the right way so that they don't get hurt. Right, guys? Yeah. Chiropractor Dr. Michael Robb joining us now with some tips. Thanks for being here.
Thank you.
You know, I think a lot of us we see them and the kids are slumped over, or there's so much in their backpack. Where do you even start? What's the first thing we want to look at?
Well, there's about 5,000 injuries per year for kids that are making trips to hospitals because of overloading backpacks. So the backpack should be no more than about 10–15% of the child's weight. Okay, let's start with Jonathan here. Yep. Jonathan, how old are you, honey?
I'm 5.
5. Okay, so let's put this backpack on you. And Dr. Robb, what should we look for when sizing one up?
Okay, so make sure that we have wide straps. Make sure that the bottom of it doesn't go 4 inches below the waistline.
Okay.
But also not using additional things like this that add weight. All these things will add up, cause increased weight, and as a result of that, the child will have to bend forward. This is where the injuries will come into play.
Okay, and you know, there's always that strap that sometimes that you buckle up in the front. Should you be using that on the kids?
And this is the strap, one of them, that we put this together in the front. What this does actually keeps the straps together, high on the shoulders. The extra thick pad there, pad on the back. And there's usually one on the waist as well, but we're seeing more and more without the waist. And
so the chest is the important one.
Exactly.
All right, we've seen the rolling ones versus a traditional backpack. What's your take on that?
So this is a rolling backpack, so they can roll it. It's also versatile, that if they have to go up steps or they have to store it, they can also use this as a traditional backpack.
Oh, okay.
So all the straps on there, the pads are there. A lot better for rolling heavy weights.
Okay, and then the strap so that if you have to take it up the stairs if you're in a school like that. All right, signs and symptoms, though, that the kids, I know you mentioned the drooping and things like that, that it doesn't fit right or that it's too heavy.
Now, this is a typical backpack that a child will use, and this is way too much weight.
Look at how big that looks.
And it's hanging way too low. But this can cause tingling, headaches, back pain, and then, of course, the nerves in the lower back also innervate the bladder. So kids will have increased urination, these type of things, all associated with putting too much of a load on their back.
And parents probably see all those symptoms and they think, oh, it's something else, and it could be because of the...
That's right.
I'm noticing, too, here on the back, if we can show this. Turn around for us, sweetie. There's a rip in that, a big sign that this is not working and it could be causing problems.
That's right. This is stress, undue stress, and if the backpack is getting that kind of stress, the child is as well. You can see the posture. He's having to lean forward to counterbalance that weight.
Feel heavy? Yes, all right. Well, let's just take it off. Let's take it off. There we go. So I think it's also important to note, you know, it's interesting. You say stretching is important. So even for the little kids, to make sure their backs are strong and can carry the weight.
Let's have you lie down on the ground on your stomach. And this is one of the best stretches to do. Now, push up with your hands. So we arch that lower back this way, which is just the opposite of carrying heavy load, which pulls us forward. In this position, a couple times a day, carrying heavy loads will prevent back injuries, and these kids will grow up with healthy backs.
All right, so when maybe the kids are having some downtime at home after school, watching cartoons, this is a good thing to do on commercial breaks, right?
Best position to be in the world.
Jonathan, doesn't that sound like fun, too? Yeah? He's like, no, but okay, whatever you say. Dr. Robb, we could talk about this for a while, I know, but we thank you for the tips that you've been sharing us. If you'd like to get a hold of Dr. Robb, he's a chiropractor at Fix Studio. We're going to put all the information on azfamily.com.
Thank you.
Thank you so much. And have fun at school, guys. Have a great year.